Good morning, the Ridge Medical Practice. Vicky speaking.
Try not to bite my finger off, okay? I need it for work.
And do you know why I would like you to stop smoking?
Because of my chest, I know.
Do you feel like harming yourself?
Not right now, but you never know, do you?
It's funny how you've been well all through your school holidays, and then the day you go back to school, you get poorly.
Your sugar now.
Pre-diabetic.
Yes, you're getting a gold star.
Woohoo!
Morning, Emily.
Morning.
Come in.
Oh,
Hello.
Hi. Are you ready for us?
I am, yes. I just dazed off and gone on to something
It's
else.
quite all right.
Come in. Hello.
This is Betty.
Hi.
And I'm Jane. I'm looking at a daughter-in-law.
Oh, right, okay. So they seem to say you had a few bits and pieces that they wanted us to
it
check.
started with that about 5 years ago.
Oh,
Then that.
right.
And I've had put Germaline on every day, but it hasn't moved it.
Right.
And then I've got all sorts.
You have, haven't you?
Yeah. And I've got one behind there and that itches. Can you see it?
Yes.
And then I've a few. One on my shoulder there.
And then on your face, this
Oh,
one.
these are mostly, I won't get rid of these. I'm not bothered about
You nearly forgot about
that
them,
one.
didn't you?
And these, I mean, these are driving me mad. There's one behind me here. And that cheek there. And the touch on my forehead there.
Oh, goodness me.
But I want rid of all these on my face. I mean, my beautiful face, you see.
So can I have a look at them? Sorry, this is a bit of gel.
Of course you can.
Yeah, and a bit
I
of a
just
light.
want rid of them on my face.
I've been feeling,
Poorly.
yeah,
Yeah. Any high temperatures? Have you felt hot?
Yeah, she had a temperature this morning.
Did it wake you up in the night?
yeah, as well,
What kept you awake?
in my throat.
Was it really sore? Okay. Shall we have a look at it? Come on then. Were you going back to school today? Is this a big drama to get out of school, do you think? It is a drama to get out of school.
Better not be Halima.
No, in here. Let's have a look. Oh, your temperature's high. 38.3. Right, give me a big R. R. Oh, it does look sore in there. You can sit down. So you have got a bit of an infection in your throat there. We'll give you some antibiotics and you can go back to school tomorrow.
Okay.
How's that?
Good,
Good for Dad.
good.
It's funny how you've been well all through your school holidays, and then the day you go back to school, you get poorly. I believe you. That thermometer doesn't lie. Drink lots and lots of water, because your lips look a little bit dry. We don't want you turning into a raisin, do we? What if you wake up tomorrow morning, you're a raisin? Can't go to school then, can you?
Don't we?
Put you in some scones. That's a good idea. All right, darling. I'll see you next time. All right.
Oh, mate, take care. See you later.
No worries.
Sorry, what made you sort of come now? Have you suddenly got a load more?
I've been
or
telling
what?
the doctor about this for years.
Yeah.
And they said you'd better go see a dermatologist.
Yeah. What about these on your face? How have they sort of progressed over the past 6 to 12 months?
Sometimes bits drop off.
Yes. That's not anything to worry about. But still, we want to try and treat them, and I'm just trying to think how's the best way to do it. So you've got a lot of different bits and pieces.
Yep.
I think that they are mostly sunlight damage. I was wanting to get the advice of our consultant, and she's here next week. I know it's a bit inconvenient to come back, but I'd just like another brain to help me suggest what to do, whether there's some that she thinks she's a bit more worried about and perhaps we should take a little sample, and whether there's others that she'd just be happy to put some creams on that will irritate. So they'll go quite nasty and crusty, and then it starts to come back beautiful again, but without surgery.
It'd be nice if it were ointment from my face.
I know.
Yeah.
Well, it wouldn't be nice while it was working because it'd get really crusty and it'll look a right mess. No, but it doesn't matter because after a couple of months it'll look beautiful again.
Oh,
so
yes.
that's what you want, isn't it? It's a full facelift. Okie doke.
Thank you very much.
You're welcome.
Lovely.
Okay. Thanks for your help. Thanks. Take care then. So I'll see you next week.
Yeah.
Turn right. Turn right.
Bye.
This way.
Oh, I'm going the wrong way.
I've got a really, really, really big spider. Oh, wow, it is a big one. Look at it.
Oh my God. It's a monster, Shelley.
It is. Now I need something to shimmy underneath. Come on, mate. Ooh, look how big he is. Whoa, oh my God. Absolutely huge. I'm gonna just go. Let's go for it. There you go. Ugh.
Hello, good morning.
Hello, Mohammed.
How are you?
What can we do for you today?
Well, basically, I need some balm cream for my leg.
And what's the cause of that?
I fell and scraped my leg on a door.
Right.
And it flared up and everything, you know. That's 2011.
So quite a long time ago.
Yeah. It's still there, the marking, because when I'm walking, especially when I'm doing a bit of exercise, the blood's flowing.
Yeah.
Then it gets really itchy. I mean, as you can see, the skin gets really dry.
Yeah.
And it starts flaking off.
And has that colour and appearance changed over the last few weeks, few days?
No.
No, fine. Have we tried any steroid cream on that?
No, I don't believe we have.
Why don't we try that?
What will that do? Will that help the itches?
Steroid creams reduce inflammation. So when things are irritated,
Right, okay.
then it kind of calms them down. So I'm hoping that that's going to improve the itching.
The other thing, right, any chance of getting a full MOT done on myself?
So you're 51. Have you had, anyone over 40 is entitled to a one-off NHS health check MOT.
No.
Have you had it?
No.
So you can book in for that.
Do I need to book it?
Yeah. But just use the words health check, NHS health check. Right. And then what they do is they check your blood pressure, cholesterol, height, weight, give you a kind of once-over.
Right, that's fine then.
Unless there was a particular concern that you had, you just,
I mean, to be honest with you,
general MOT, but...
Yeah, I mean, to be honest with you, I do get some pains in my chest now and again.
Really?
Yeah.
Oh, you should tell me about that. Don't just have an MOT. No, you should share that with me, please. Tell me.
Yeah.
No.
You do the exercises, don't you? Yeah.
Exercises are the way forward.
Are you doing any stretches? Weird movements, yeah, okay. Can you just pop your arms out again for me?
And your legs rotated a bit, and she cried. Oh, dear me. I'm tired, Janet.
What have you been doing?
Nothing.
Nothing.
Sometimes do nothing makes you more tired.
It does.
Come in. Hello, come in. Mr. Hussein.
It is.
Come and have a seat.
Thank you.
I have a student with me as well today, if that's
problem.
okay.
That's no problem. I seem to be getting a lot of pain. It's been like just over about a week and a half.
Mm.
It's like all back of here, all my arm, and it seems to be, like within the muscles. I mean, as soon as I press, I can feel the pain.
Okay, and anything trigger it that you can think of? You've not moved house or lifted heavy stuff or...
If I did do it, I mean, I'm more right-handed. I would have done something with my right hand, not my left.
Okay, let's have a look then, shall we? So, if you just stay sitting for a minute. Is it tender up here?
Yeah.
Whereabouts? Is it?
Well, it's more
at the back?
Yeah.
I could do to have a look at this shoulder. Do you think you could take that arm out your T-shirt? I'm conscious of you.
And can you tell you the truth? When I'm sat down not doing anything, you can feel the throbbing more, you see. That's, really tender,
So can you lift your arms up in front of you?
Yeah, I mean, I can lift them up. I can feel the pain hurting more when I try to lift it up more high.
Can you lift right up to the top? And that's hurting here in this muscle?
It's hurting all the way along here.
Okay. Can you lift your arms out to the side?
Yeah, I mean, I've tried all this at home, you know, just to kind of try to ease them off.
So from looking at you, you can put your arm back in your T-shirt now. From assessing you there, I don't think this is the shoulder joint. I think you're right. I think it is a muscular pain. Perhaps you need to have a think about what could possibly have caused it. But the main thing I would say is give it some time. Give it a couple of weeks. And if it's still there in sort of 4 to 6 weeks' time, come back and see us. But I would expect it will go.
But what would cause it going all the way right down?
So you've pulled muscles. You've pulled the muscle here in the chest, and you've also pulled some muscles in your arm. How? I'm not entirely sure, but it seems to me like you've strained some muscles, maybe by lifting a bag or I don't know. It can be quite a fine balancing act, getting it right between not being dismissive and listening and understanding patients' concerns. In primary care, us general practitioners are gatekeepers, and it's okay to watch and wait sometimes and not jump to investigations straight away.
It just kind of hurts a lot, you know.
But I wouldn't worry. I'm confident it'll settle. Okay.
Yeah.
All right then.
Okay, my
Okay.
love.
Thanks very much.
Okay, madam. Okay, thank you.
Take care.
Okay, my love. Thank you.
Bye-bye.
What about these chest pain?
It's just sometimes it's difficult to breathe, you know, on the left side. When I'm breathing, you know, it's painful.
It just catches you?
Yeah, it just
when
catches
you're
me
breathing.
now and again, yeah.
What about if you're really pushing yourself physically, rushing around?
I haven't really had much of that, to be honest with you. I don't get pain. It's like, you know, you get a stitch.
Oh, okay.
Yeah, it's that type of thing, you know what I mean?
Okay.
And when I'm breathing, you know what I mean?
Right.
It's quite painful to breathe.
And how long has that been the case for?
About a couple of months now, really.
Do you smoke?
I do smoke, yes.
Okay, all right. So do you have a kind of chronic phlegm, cough, or?
Just normal white phlegm.
Right, okay. Yeah, it doesn't sound like angina or heart pain.
Right.
It could be a bit of lung pain, or it could be a little bit of muscular pain.
Right.
I don't think the MOT is going to help that. But book in anyway.
Yeah.
Because they check you for diabetes, they check your cholesterol, check your blood pressure.
Yeah, I mean, my mother's diabetic and so is my father.
Yeah, and you're a man and you're 50-ish.
Yeah.
And you're Asian. All of these things put you at higher risk of having heart disease. I mean, obviously the fags won't help.
No, they don't actually. You know, I mean, I'm trying to reduce them as much as possible, and hopefully, you know, come off them. But it makes it very difficult.
Okay, excellent.
Right, thank you very much, Dr. Youssef.
My pleasure.
Thank you.
Bye.
See you.
What? Oh. Mrs. Kirby, please. Have we a Mrs. Kirby? Oh, bloody hell. Mrs. Ingham, although you're not on my paper list for today, my computer has all of a sudden woken up rather groggily, and your name is on my computer list. Anyway, come and let's both fight with the computer, shall we?
Computers are great when they're working.
Here we are. Come on in.
Hi, Tatiana. I'm Dr. Carr. Nice to see you. Come and sit down. So I believe I'm seeing you for something on your knee. Yeah, okay. How long have you had that for?
I have a couple years already, but before I even came here, but it was very little, and it's now growing more.
Yeah.
And that's why I'm all the time with babies. I'm staying on the knees,
okay.
and it's make pain for me.
Yeah, of course. Do you mind if I have a closer look?
Yeah.
The only bit you'll feel is a little needle going into the bottom of it and putting some medicine underneath it to numb it. After that, you shouldn't feel anything at all. We then make an incision over the top of it, and it should just come out, and you'll have 2 stitches which will dissolve themselves over the course of a week. And you might be left with a little scar where it's been, and otherwise...
Maybe better.
Maybe a lot better than what it is now. Yeah, definitely.
Yes,
happy to get rid of it. Good. Right.
So if you make yourself comfortable on here...
Do I need shoes off?
You're okay. It's fine. How old's your baby?
Oh, 8 months now.
Oh, how nice. Is it your first one?
No, third one.
Third one? Wow. How old are your other 2?
6 and 2.
Oh, you are busy
Very
lady
busy.
then. Yeah. Are you nervous? Don't be nervous. It'll be all right.
So I'm Susan Towers. I'm a GP, but with an interest in skin problems. That's why it's Sister Eve, wasn't it, that sent you here?
Yeah.
Linda.
Linda.
Okay. She said that you've been having trouble with your face for a few years.
Yeah. It's been after the birth of these twins.
We're blaming them, are we? Yeah.
No, actually, everything was right. Everything was okay. My face was really good. But it's been last 2 years I am having this problem.
Right.
And I am having it just before my period, every month. Sometimes every month, sometimes every other month. Can you see this spot?
Yeah.
All around my face.
Yeah. Is this a good day, is it?
Yes, it's really, really good.
Well, we can definitely do something for this. This is acne, and in some people it does start later on in life. It usually starts in the teens, but in some people who are unlucky it can start in the 20s, 30s, even 40s, and then it's much more stubborn, unfortunately. So sometimes we need to use quite strong treatments. The problem that you've got is caused by your grease glands being too active. They're making too much grease, and the gland itself is getting blocked. Okay. So when there's too much grease in a gland, sometimes you can see it like a blackhead.
Yeah, blackhead, whiteheads everywhere.
Whiteheads, exactly.
Yeah.
And then sometimes the gland sort of stretches and stretches and gets very inflamed and red, and that's those red lumpy bits that you're describing.
Everyone this pop.
Yeah.
Oh my God. Sometimes at night,
Really
sometimes
sore.
in morning.
What I'd like to suggest to you is this strong treatment called Roaccutane, which really shrinks the grease glands and makes them small again. It's the only treatment that does that.
Okay.
One thing that's important is you can't take this if you could be pregnant or planning a pregnancy in the next few months.
No, not at all.
No, not at all.
No.
Because this tablet always damages a baby as it's growing.
Okay.
So that you would be advised to have a termination. So it's really, really serious. Okay, so that's one thing.
Yeah.
It can also affect your mood in some people. It's very important for patients to understand the potential side effects of prescription drugs. It's a bit of a contract between us and the patient. We need to think about whether it's safe for them to take that medication, if there's other things that might interact with it. Most medications are taken safely and without any significant side effects, but if there's some particular medications which we think have a potentially serious risk for an individual, then it's important that we talk about those. Sorry, I just have to ask that personal question again. If you're sexually active, you must use 2 methods of contraception because this medicine so often damages growing babies.
Okay.
But just bear it in mind. And each time you come, we'll need to check a pregnancy test. So don't be upset that we're asking you to do a pregnancy test. It's just what we've got to do. Okie doke. So we'll be seeing you probably in 4 weeks.
Okay,
Right.
thank you.
You're welcome. Thanks. Take care now. Bye-bye.
I'm just going to test it. Tell me if this feels sharp.
No, I feel that you touch, but not...
Yeah, nothing sharp. That's fine.
No.
You'll feel a bit of pushing and pulling, and that's normal.
Yeah.
You know, Tatiana, I'm opening this up now, and it doesn't look like a cyst. It looks like a bit like if you got something in your knee, like a piece of wood or metal. So
Like something inside.
Yeah. Often people get like a little chip of wood or a little chip of metal under their skin, and then you can form a granulation tissue around it, and it forms this hard surface like this. So I suspect that's what's happened. And it's in one of those positions where you're likely to kneel onto something, and it...
Yeah, when you touch, it's like little ball inside.
Yeah.
You know? It's not...
It's okay, we'll get it all out. It's not a problem.
You okay?
It's nearly done, yeah.
Is it hurting?
No, no.
All right.
It's all right.
Really doesn't want to leave you, Tatiana.
No, it likes being in there.
It's quite at home here. Right, it's gone. We're just going to put the stitches in and then we're done. All that for that. You have a nice smooth knee now. You'll have a bit of a bruise where it's been, but it's all gone. And Karen, I'll just put a little dressing over it, and that's that.
I'll just lower the
Thank you very
couch
much.
down.
No problem. In a week's time, it'll look beautiful.
Okay, thank you. Thank you.
Hello.
Hi, are you okay?
I'm fine, thank you. Sorry to keep you waiting. How is your dad? How is he feeling?
That medication you give him isn't working at all. So we've had a lot of down days. He don't go out or anything now. He's just enclosing himself in house.
Okay.
So from last time we seen you, It's just got worse.
Okay, he doesn't want to leave the house.
Yeah, he tries to enclose himself.
Okay.
He's fell more into depression and anxiety and feels more worthless.
When you say worthless, is he trying to harm himself?
Yeah, we had to ring first response unit and they said they're going to send him an appointment out.
About 4 times a day they were ringing.
Yeah, they said they're going to send him an appointment out for mental health team because he needs to be assessed. But I told them we had an appointment with you today and they said that it'd help if you could refer him to mental health team as well.
So they want me to refer him to the mental health.
Yeah.
Okay. Do you feel like harming yourself?
Not right now, but you never know, do you?
Okay.
Anything could just trigger it. It's what goes on. It's what the voices he's hearing in his head and stuff.
Oh, is he there? Is he there? Oh, he is, and he's got blue eyes.
Brain surgery. Well, there's no brain there.
That's naughty, isn't it? Hey, look at you. Come in. Right, so which one's Hardy?
Hardy's this one.
Yes.
He had been diagnosed with hand, foot and mouth.
Yeah.
So that's...
How is he doing after that now?
He's not been too well, you know. He's, it doesn't seem to be picking up. And like his mouth, he's always sore. And it's still like, I can see a few spots in there.
So is he eating and drinking?
He's not back to his normal pattern of eating and drinking since the hand, foot and mouth.
Yeah.
But when he does eat, sometimes he'll complain like, ow, that hurt.
Okay. Did he have any ulcers or any skin problems anywhere else when he had this?
He had some spots on his
What
hands.
about
They've
his
all
feet?
cleared up, and on his feet.
And if that's all better
There's one
now?
little scar left, but it's all cleared up.
Can you take his top off for me? Hardy, can I just have a listen to your chest, sweetheart? I know it's not nice coming to see the doctor, is it? Good boy. His chest is lovely and clear. I'm just going to check his temperature quickly. I'm just going to pop this in your ear, sweetheart. It shouldn't hurt. That's perfect. Can you open your mouth for me, darling?
Go ahead.
Ah. Ah. Stick your tongue out, like really naughty. Be really naughty and go,
How do you go like this? Good boy.
Ah.
On that side as well, I saw the spot. Don't know if you can see him there.
I'm going to put my finger in your mouth for 2 seconds. Try not to bite my finger off, okay? I need it for work. Can I just have a feel, my darling? Does that hurt?
Where's it hurt, Hardy? Oh.
That's fine. That's good because he opened his mouth. He's got a tiny, tiny ulcer in the back.
Is it just the one?
Just the one that I can see. The throat doesn't look inflamed or anything. I can't see anything that worries me. So it can take a bit of time for these ulcers to get better, especially the ones in the mouth. Have you tried to use anything?
Bonjela.
Yeah, and is that helping?
Not really.
It's the only thing that we can really recommend for kiddies that age. You probably know this already. So I'd advise you to carry on using that Bonjela. But if he's still not right in the next couple of weeks, then just bring him back.
Okay.
They're all very good, your kids, aren't they? Is it an act?
A cover up.
What do you want me to do for him today? Because I can speak to the first response, okay? If he's feeling suicidal,
I think what we need to do is possibly if you could refer him to mental health team for mental health team to assess him personally rather than on a phone.
Okay, I can do that, okay? Are you happy with that? Yes?
Yeah.
Okay. Will you be there for him?
Yeah,
and will
there's
somebody be on
family's
him?
watched all the time, yeah.
I hope you understand the
out,
reason I'm asking
Yeah,
this. And we need to see him again after about 4 to 5 weeks because we are increasing the dose for him.
Yeah, that's fine.
Reasonable?
Yeah.
So we'll see him and I will refer him to the mental health team as well. Happy with that?
Yeah. Yeah.
You agree with that?
Yeah.
Yes?
Yeah.
Because he doesn't talk much.
Because he's really low. We can't let him have sharp objects around just in the kitchen to cook just in case, because he gets things in his mind and stuff.
So we'll just do what we have planned?
Yeah.
Is that okay?
Yeah, that's fine.
Is that? Yeah? All right. Then.
Okay.
All right.
Thank
then.
you very much.
Thank you.
Thank you. Bye.
You like doing this? Is this a geeky thing that you like to do?
No, I like doing that as well.
It's quite
therapeutic.
Yeah. So there's 4 number of scripts and 4 on each thing, that's 16 in it. What's 12 times 4?
12
times 4?
48.
If you wouldn't have been here, I'd have used calculator on there. I would have been like that.
Bless you.
Hiya, come on in.
Hiya.
Medication review, that right?
Yes.
And how are you feeling in yourself?
Okay.
How many do you smoke then?
I don't know, it varies. When I'm working, I don't smoke, you see.
Right.
Obviously, can't smoke in work, but I do.
What's your job?
I work at warehouse at distribution centre.
Right. Okay.
I used to work somewhere else, then I got sacked, so.
All right.
But that really dusty atmosphere in me.
Made your chest worse, did it?
Made my chest worse. Yeah. But this is dry.
Okay. So your blood pressure's up a little bit. You see that you'll always be a smoker?
Probably.
Yeah.
To some degree.
And do you know why we'd like you to stop smoking?
Because of my chest, I know.
Have you tried to stop?
Not really.
No. Can we give you some help to stop? To try to stop? What do you think? And what would get you to that point where you think, I'm going to have to stop now?
I mean, if my chest got that bad.
Yeah.
Like, no.
Yeah. But if we know your chest will end up that bad, if you carry on smoking.
So I should...
and it usually takes
stop.
people, averaging about 7 attempts to stop. So you've just got to keep trying to stop. And the message really is that if you don't stop first time, doesn't mean you'll never stop. Just keep trying to stop. Right, my suggestion is just maybe start you on 1 blood pressure tablet and come back and see me in about 3 to 4 weeks, and then we'll make sure that you're okay on that tablet. But I'd like your blood pressure to be a bit lower. Is that okay?
That's fine.
And do come back and see me.
Yes.
Yeah.
Don't worry, I'll come
Don't sleep in.
I won't sleep in, I never sleep in.
That's all right.
Once my alarm goes off, I'm up.
And have a think about a few of the things we've just been chatting about.
I will do.
And then we'll set up a plan for the future when I see you next time.
Right, okay, thank
Cheers. You take care.
Yeah, you too.
See you, Paul.
Okay.
Pauline.
Sorry, I was in the ladies.
Is it working?
Sorry, yeah, oh yeah, I was in the ladies, so I didn't get it. Sorry.
I'm putting it back. Right, I've got
Student again.
Supreet here,
Yeah.
a doctor,
Oh,
one of our new
hello.
doctors who's just learning the ropes.
Oh, bless you.
Right, Pauline.
Yeah. First, there's 2 things. First one, say that still going really well with the tablets. I still feel anxious, still not sleeping well, and I still get moments of just feeling numb. I don't know, I just need advice.
So at first, when you first started the tablet, they helped?
Yes, they did.
They help with
yeah,
the
for the
sleep.
first couple of nights they help.
The fact that you have noticed a positive difference is really good, because usually we say allow it 4 to 6 weeks.
Yeah, so it's been 4 weeks I've been on them now, I think. Still not getting off straight away, but then when I do go off, I have a really good sleep, so that makes a heck of a difference. It does, it feels wonderful. The other thing, I've got ulcerative colitis, and I don't know if it's a coincidence, but 2 weeks ago I had a colonoscopy, and since then my tummy just hasn't been right. I've had constant diarrhoea. I spoke to the IBD specialist nurse, and I went to the hospital Monday, took up some stool samples, and they took some blood samples. Still haven't had the results of those back yet.
So before the colonoscopy, they'll have had to give you some bowel prep, won't they, to clear you out? I wonder if it's that then that's sort of aggravated things.
Yeah, exactly. But it's never... I've had quite a few colonoscopies, obviously, and I've never reacted to it in this way before.
No.
And
That
it's
was
just coming
sensible.
out of me like sludge,
Yeah.
really, you know. It's just not formed at all. The problem is I had to come home from work last Thursday with it because I just couldn't work. I travel on the bus, I don't drive, so of course I
It's
can't...
access to the toilets. It's not pleasant, is it?
No, that's the thing. I mean, I wouldn't dare go for the bus because, you know, it comes on urgently and I have to go. So really I need a sick note, please, for another week just to hopefully get some results back and get back to something like normal.
Of course we'll give you a note.
Thank you.
Yeah.
It's just never gone on this long before, you know. It is what it is, isn't it, unfortunately? There's nothing I can do.
You did the right thing by phoning the nurses, so hopefully they'll pick your message up and they should have the results back by the end of today.
Yeah, hopefully, yeah.
I mean, I know they're busy, aren't they? But
that's lovely. Thank you for your time again today.
All right
Much
then, no
appreciated.
worries.
Thank you.
Take care.
I will, and you. Bye-bye.
Bye-bye.
Bye.
My mum wants to get a dog. I said, who's going to look after that?
So I've just got a dog and he's only 7 months. Labrador, yeah. They're just greedy, aren't they?
How's your little doggy?
He's all right.
Oh, have you got enough him now?
No, he's been a little bit naughty this week.
Oh. I smell something right weird. Have I stepped in some?
My first ever picking up dog poo experience, which was quite a big thing really, the first time. And he did a poo on a bramble, a sloppy poo.
It's not me, is it?
But there was someone behind me, so I couldn't ignore it.
I'm funny.
Coming in. Hiya, Mr. Russell.
Yeah.
Hi, it's Dr. James. Nice to meet you.
Oh, I've sat down enough. I've sat down enough. I can't
Do you want to stay standing up?
Yeah, she don't.
That's fine. Yeah, I'm cool with that. How can I help you today?
I've had a crick in my neck,
Yeah.
but I've also got a bad back.
Right.
I don't know what's happened. I took my dog. I went up to hospital a couple of weeks ago because my dog went through my legs and dragged me over. I'd badly sprained my leg. It was in that much pain I couldn't walk on it. But I didn't mention my back, but my back's just got worse and worse and worse, and it's really sore and I can't sit down.
And how long ago is it now?
About 5-6 weeks.
Oh, right, so it's quite a long time.
It's quite a while ago.
So can you show me which point it's most tender on?
It's mainly this part here.
OK, I'm just going to gently feel down the middle of your spine first.
Just
OK. Is it there as well?
Yeah, that's it.
Sorry,
That's one.
sorry. And you're able to just lay down on the couch here? Then just let me know if you feel any pain. Right, where's that?
That's just a box.
Bottom there.
Bottom.
About this side? Same place?
Yeah.
I'll let you jump off then, just nice and slowly. Jump off's the wrong word. Just gently step up.
So when I breathe as well, that hurts.
It's all spasmed up, isn't it? And what your body does in response to any pulling injury on your back is it thinks, oh no, that's my back's important, I need to keep it stable and the muscles go really tight. It's almost a bit like a whiplash injury, you know, when you jerk forward and then you get really stiff neck. It sounds like the injury you've had is a bit similar like that with the jerking with the dog. So we could use an anti-inflammatory and that would help bring down some of the pain and some of the tightness a little bit. And then the other thing is, what do you think about seeing a physiotherapist? Is that something you'd be interested in doing?
Yeah, I'll have to do.
There's a drop-in physio here on a Wednesday lunchtime. You can just come in and see, and they'll give you like a one-off kind of work over and give you some exercises. There's your prescription. Okay then.
Cheers.
Take care now, yeah. All the best. You're all right with that. Take care now.
Thank you. See you later. Bye.
Bye now.
Bye-bye.
Come in. Hiya.
Good morning.
Raymond, come on back. How's things going?
All right as such. The rolling pains have gone, but I've still got bad stomach ache. I noticed about a month ago when I went to toilet to poo,
Yeah.
the water was turning an orangey colour, and yesterday when I went,
Yeah.
there were some streaks. I don't know if it's blood or not.
Right, okay. And are you going to, when you go to the toilet, are you going more often, or is it just once a
No,
day as
it's
normal?
twice a day. I usually
Once
go
or
twice a day, and
Okay.
usually first thing in the
And how's your
morning.
weight doing?
All right, as far as I know.
You
I don't think I've
You don't
lost
think
any.
you've lost any
No.
weight or anything?
No.
And we've got your blood due today, haven't we?
Yeah, I am had chance.
I know,
to
it
be
don't
able-
matter, so-
With work, I am had chance to.
Well, I think the
go.
fact that you think you've probably had some blood, I need to examine your bottom end, if that's okay.
Right. Yeah, no
And
problem.
then that changes the position a little bit. We might end up referring you for further investigations.
Okay.
So do you mind if I do the bottom end?
No.
That's great. So if you just have a lie back on there for me.
I'd not thought anything about it. I just thought it was me poop turning water.
Yeah.
It's not clots of blood or anything like that. It was just with me noticing it being streaky yesterday.
Yeah. So what you'd need to do is probably just undo your trousers and your underpants and then turn over onto your left side and lift your knees up to your chest. Is that okay?
Yeah, that's no problem.
Great. I'll just get some gloves on. You had this done before?
No.
Looking forward to it? Nobody's ever said yes yet.
No.
There you go.
With a cough.
Yeah.
Did you say she's got a cough?
Choking.
Oh, Jesus. Oh, ow.
Hello, sorry about that. You broke up a little bit. Can I help?
Great stuff, that's us finished. Just hang on a second, I'll get out of your way. I think the fact that you've got this ongoing grumbling abdominal pain and the fact that you've noticed probably some blood, we ought to refer you on for bowel investigations.
All right.
Because that means having a look at the bowel all the way around, up from the bottom end.
Right.
And what we're thinking about is making sure there's no polyps. So these are little growths in the lining of the bowel that can bleed.
All right.
And sometimes those polyps can be early signs of cancer in the bowel.
Yeah.
And that's the thing we want to be picking up and making sure that we're not missing. So even though it may well all come back all normal, I think it's the right thing to get on and get those investigations done. Is that all right with you?
That's fine, yeah.
Right, we'll make arrangements for that to happen. What they'll generally do is a colonoscopy examination right round the bowel, make sure it all looks clear.
Okay then.
All right.
Thank you very much, and thank you for
nice
your time.
to see you again. No, don't worry,
Thank you.
Raymond, thanks. Well, I'll just walk you down to get your bloods because Jess is waiting for you.
All right.
We can get you sorted out in one go, can't we?
Yeah, sorry.
Yeah, you follow me.
Sorry about that. I have to go and review a patient next door.
Absolutely fine.
Right, so I'm Dr. Khan. How can I help?
What it is, I can't walk on my heel on my right foot.
All right, yeah.
Don't know what I've done. So I thought, I'll leave it a couple of weeks, I'll take some anti-inflammatories, get it down, and it hasn't gone.
Yeah.
I've had ice on it, everything, nice baths, no taking it down.
Let's take a look. So show me where you get the pain.
Just right in that area, just in that full area there. So every time you touch it, alert.
Yeah. And just remind me what you do for work. You say
I'm a drainage operative.
Are you on your feet a lot?
All day.
Yeah.
All day long.
Okay. So I think you've got a condition called plantar fasciitis. Have you ever heard of that before?
No, never.
Right. So let me just show you what I mean. So this is the plantar fascia, that lining of tissue that runs under your foot.
Yeah.
And that's the bit that can become inflamed.
That's what's hurting me.
Yeah, yeah. And you can see it's exactly the place where you're getting the pain, really. So you've done the anti-inflammatories and the resting side of things. The next step is really trying to get that more elastic again by doing some exercises, which I'll show you. If the exercises with the painkillers don't work, the other option is then to think about injecting it with a cortisone to try and loosen it up, which is a really powerful anti-inflammatory.
Okay.
So you can see these pictures here.
Yep.
We have to stretch it out really. So you lie down with a cloth, lie on the floor, and you pull your toes back.
Towards you.
Because what that plantar fascia links into is the tendon at the back of the heel as well. So, say this is the foot that's the problem.
Yes.
And you pull in there, and what you feel is a stretch all along there.
So
and
basically all you're doing is stretching your calf muscles.
yeah, because you want to pull it up really.
So that, yeah, okay.
The other thing is this. This is a really good one, but you use a tennis ball rather than a rolling pin.
Yeah.
And you just roll your foot back and forth over a tennis ball. And if there's any
Like a massage?
Yeah. The thickened bit will start to break up and then soften. So I'll just print this off for you.
Brilliant.
It's a really common condition, so don't worry about
Right,
it,
I
and
won't
it's
worry then.
easily treated.
Right, thank you very
All
much.
right.
Sir. Yeah,
Okay,
cheers.
thanks for
Ta,
coming in.
thank you.
Cheers. Take care.
Janet thinks I've lost a pound. I'd say I've been trying this week, really.
That's good then.
That's all right, isn't it?
When you've lost a pound and you've been really good, you're like, a pound.
Yeah.
But then when you might been that good, you're like, a pound! Like, it's never acceptable.
I remember I went and I'm like, I've had a really bad week and I'd lost £6. I'm like, has your scales got problems?
What? That's never happened to me.
I have no idea what were going on. How did I do that?
How have you been? Good. Come and take a seat. Last time we weighed you was November 2017. You were 13.10. You're now 12.11. So
Wow.
stone off. Is it anything to do with cake?
Yes, I have stopped baking.
So you've had all your bloods done for your diabetes?
Yep.
How do you think you've done?
Well.
Okay.
Because I'm very careful.
Okay. Your sugar now.
Pre-diabetic.
Yes. 39.
Nice.
Yeah. Cholesterol 2.5. Excellent. Kidneys excellent.
Good.
You're getting a gold star.
Woohoo!
Right, you're on a lot of tablets, aren't you? Losartan for your blood pressure. Lansoprazole for your stomach. Bisoprol. Amitriptyline. Yeah. Sitagliptin for your sugar. Olive oil for your ears. Pregabalin.
For the pain, joints.
Yeah. Laxido.
Yep.
Constipation. You've got inhaler. Fibrogel. Ibuprofen. Manivec. Torvastatin for your cholesterol. Mebeverine for your tummy. Mood tablets.
Yes.
Okay, so we might need to take a tablet out. I'm just doing yours now. Please stop glimepiride 2 milligrams as hypo risk. And excellent diabetes control.
Ooh, I'm gonna go eat all the ice cream I can find. No, I'm kidding.
Did they ask you to bring a urine sample?
No, I keep forgetting also.
Okay. If I give you a bottle and a form, will you be able to do it?
Yeah, I'll be able to bring it back.
All you need to do,
just put it.
Leave them in there, put your urine in there, drop it back at surgery.
you.
Oh, it's lovely to see you.
Yes, and
Everything's
tell your
really
boy
good.
Happy birthday for me.
I will
The
do.
best people are born on our birthday.
So let's see you before your birthday, yeah?
Okay.
Kidology.
Next year.
Yes.
Wow, a whole year.
Yeah, a whole year. If you find that sugar starts to creep up, come back sooner.
Yeah.
But I think you're going to be fine.
You look after my
And you.
for me.
See you later.
Yes.
I'm going to Bye. Go that way.
Oh, okay.
Bye.
Bye-bye.
Let me get the dog for you. Bye-bye.
Cheers, mate.
Take care. Bye.
It's nice meeting you, love.
Nice
and
meeting you too, honey.
have a good life. Stay as you are. Thank you.
You too.